Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Farid Sabet. He's a psychiatrist, and today's Kevin MD article is The Psychological Trauma of Polarization. Farid, welcome to the show.
Thank you very much. It's nice to be here.
All right, let's start by briefly sharing your story, then we'll jump right into your Kevin MD article.
Well, in psychiatry and in medicine in general, we just focus on the patient. And psychiatry, all the push and movement, my excitement has been around understanding brain functioning and neurochemistry. But it seems like we cannot, we are physicians because we have to see the interaction between the individual biology and also psychology and the existential issues that people are facing. And I think we are living, as we all can acknowledge, in a time that there's a lot of disunity and cultural harshness that goes on. And I've seen how that affects my patients, and I feel like that's something that we haven't been talking about enough. And I've had some observations that I find fascinating and interesting and helpful to the patients eventually.
All right, and let's talk more about that because I'm a primary care physician and I see that too, just with the different world events and the political climate. I do see that affecting patients from a behavioral health standpoint. So tell us more about what you're seeing. Tell us about the Kevin MD article.
Yeah, thank you for that. So, I was always raised with, I'm one of those few strange people that I switched in my residency from radiation oncology, a very technical field, to psychiatry because I was always interested in the meta narratives in medicine. What other things are going on into health and healing beyond the bench science that we have studied?
Hmm.
And since childhood, I was raised within the Baha'i community, and one of the standards that I always held very dear to my heart was one of the teachings from the luminary in the Baha'i faith, Baha'u'llah, that it talks about the well-being of a human being is unattainable unless and until the sense of unity that the person feels with rest of humanity and with the universe is established and is firmly established. And that was always, I believe that, but that was sort of a strange thing. As I got older, and I've been in practice of psychiatry for about 30 plus years, I've noticed that that's really true. And the things that we're witnessing, it is affecting our health. Disunity is literally making us sick. And so the article in Kevin MD that I was moved to write is a brief version of some of the observations I've had throughout the years that we're seeing the inner world of our patients being affected by the outer world that they see. And sometimes there's a reactivation and rewounding of the psychological traumas that they've had. This is not, by the way, limited just to psychiatry only. I think we are seeing it in all areas. I get consultations from colleagues who are like a cardiologist calling me saying, why is everybody so angry, so mad, so argumentative, so distrusting? And I think it really goes back to what we see.
So, in your exam room or office, how do these patients typically prevent, and what kind of signs and symptoms are they coming in with?
Well, I've seen a general just a sense, is not one particular patient, but we've seen a reactivation of trauma. Many
Mm,
patients show up, they have new manifestations of panic attacks or chest pains or breathing problems and sort of visceral feelings. And we know trauma, it leaves this mark on the body. And this Cartesian dichotomy between mind and body, we know in medicine is not valid at any level because all of us are really treating the whole patient. So I've seen patients like that. And when you take a life history, and I usually go over all the things they do, a lot of exposure to social media, a lot of polarized attitudes, a lot of catastrophizing what goes on, and sort of re-reflecting the argumentativeness and the anger, the hostility, sometimes even the violence of what they have witnessed in their family of origin that they had forgotten long ago. It's being reactivated and it's affecting people, and they think they just need more treatments, more aggressive therapies, more medications. And by just exploring that, I think the knowledge of that really sheds a lot of light. And that led to that article that you kindly published.
And in your article, you talk about that 24-hour news cycle, and you mention things like social media and the fact that news is constant, there's always updates, and also the fact that social media itself on their feeds, they tend to promote the most polarizing article in order to generate clicks. And tell us how this whole 24-hour news cycle and constant exposure to news, how does that affect someone's resilience and psyche?
Well, I think it's more than the constant exposure is not only to news, is the news of conflict amongst
Hmm.
human beings. And of course, anyone with a heart is affected by all the troubles and problems that we see around us in the world today. And the news media, it seems like instead of just reflecting the news, there's a lot of actually active play of people with not the best of rhetoric going at each other. And so some of the patients were saying that this reminded them, for example, someone who grew up in an alcoholic dynamic family, they're saying that they never paid attention why all of a sudden they felt panicky, but it reminded them or reactivated some of the childhood
Hmm.
traumas or experiences they had. All of us are built for unity. I think that era of saying that we're just espousing social Darwinism, that all of us are, in need of war and conflict, that's really not validated by science. That my experience as a clinician, and I think in every field from anthropology to psychology to neuroscience, is that the human world actually has evolved for cooperation, for unity, for understanding, for assistance, for helping, for mirroring each other. In fact, the whole purpose of the mirror neurons that everyone talks about in social, circles is to be attuned to each other needs. And unfortunately, the social media and our so-called news cycle doesn't reflect that. People are not even agreeing or disagreeing in an appropriate way. One of the again the quotes that I always remember that I use in personal life, that if you and I are discussing something, you and I are not going at it at each other. We're having our ideas clash.
Hmm.
One of the in the Baha'i passages, it says that from the clash of the ideas, the spark of truth will show itself. And that's how we have to approach anything. In scientific world, we've done a good job in the past that way. And unfortunately, that's even being questioned these days because you can't really agree or disagree on
Hmm.
something without it becoming a personal matter.
And it doesn't just affect that person individually, it affects them outside of just themselves. It affects their families as well, right?
Exactly. Yes, these systems begin to expand not only families, but social circles, the communities they live in. I practice in two different states, and it's amazing how the external reality of where we live is different according to the zip codes.
Hmm.
Some people have one perspective or another perspective, and I remember in the even the most contentious times, I would just always tickled because two patients that I really cared about, for both of them, of course, they would pass each other in the hallway, and if they knew how different their views are on a topic, it would be just amazing. But both of them were wonderful human beings. They had the best of humanity in mind. And again, unfortunately, sometimes the media projects it as if these people are from different planets and different worlds and should never be together. And that is the central damaging message.
So when patients like these come into your office and they talk to you about some of the things that we just talked about, how do you approach a situation like this?
That's such a good question. As you know, on another article I wrote, the job of a physician, and especially in the field of psychiatry, is that the self itself is a tool.
Hmm.
And I think a lot of times as physicians, we're not aware that we bring a lot of our inner conflicts, issues, concerns, and psychiatrists have different weird terms for these. Transference, countertransference is the view that we project onto our patients from ourselves. So I think it's really important to have that posture of a kindly tongue being a magnet that attracts people, that we really need to rise above these things. And
Hmm.
again, another aspect of psychiatry is that we've always been in the middle of a stigmatizing of the field. And so you have to work with people around what, feels more calming and healing to them. So I think that's a very important first step to see what are the forces that are going beyond. And of course, like any physician, our job is to make sure that the nice history and physical and all the other issues that might be worsening their symptoms are ruled out and looked at. But then beyond that, just having a dialogue about what are their lifestyles? Are they exercising enough?
Hmm.
Are they going for walks? Are they listening to Kevin MD podcast as opposed to a conflicting report to learn something new, to be
Yeah.
informed of the world around them? And then that's a good start. And then sort of to be in alliance with patients to sort of alleviate what might be going on. So none of the sort of over promising of calming effects, but sort of like realizing that we're all in it together.
Now, is there a story or a case study that you could share with us where someone who came to you with some type of psychological trauma from reading the news or something polarizing and came to you with a situation like that? And what would that look like on a practical basis so we could see it in action?
So, for example, in the middle of the elections, I saw a young lady who was having escalation of her panic symptoms to the daily point. She couldn't function anymore. She herself was a highly accomplished, intelligent therapist and professional. And again, I'm doing amalgamation of a few
Hmm.
patients, so we're not giving anyone's particular information. But the fear was that she was having panic attacks because she was going to get together for family get-togethers with in-laws who had a very opposing view of hers. And in fact, she considered that just from out of this world and
Hmm.
so toxic that she couldn't tolerate. And by just exploring that a little bit, and of course, I reassured her that we're going to manage her symptoms, address her problems, address her concerns, make her functional, and be available. So, several things came up, for example. She remembered the arguments and the hostility and the harshness of her own childhood, and how the parents' arguments reminded her of all the stuff that goes on TV and then in this family gathering that would go on. So, we had to work with some of her psychological trauma as far as reducing her exposure to the corrosive effects of this reactivation of trauma. She was receiving appropriate pharmacological therapies. I gave her some sort of as needed breakthrough management of her symptoms before she managed a family gathering. And then beyond that, we did some exploration as far as looking at these people. How would she approach, for example, in her own practice, if she saw a delusional patient? Would she be mad at them because of some of their delusions? And we really have some of our false beliefs or what I think in an existential spiritual dimension could be called vain imaginations of people by seeing people beyond those thoughts that people
Hmm.
are not coming up with their own thoughts. As you well know, when you interview people, very few people have original thoughts. They're just parroting somebody else's thoughts. She was able to develop a higher sense of empathy and begin to see that. And then so we stepped into it. I also treated exposure to any kind of conflict-based relationship like a medicine, that it should be dosed properly. So we timed her maybe after half an hour, she would remove herself from the situation. And thank God it really went well for her. She was able to see their humanity. She was able to see that people have reached those areas because they were also in their own echo chamber. And we explored some of her own sort of catastrophizing mindsets that she
Hmm.
was having, just generally exploring a case like that.
What kind of advice do you have for people who just comes across a political post? It could be just reading the newspaper or on their Facebook feed, and it makes them anxious. So, what kind of advice do you have in that situation?
I would say that, I mean, there are things that we all should be anxious. I always tell patients, I think it's a quote from Miles Davis, the jazz musician, says, if you're not anxious, you're not paying attention.
Hmm.
So I never come across that I'm not anxious about things happening in the world. Who isn't? We want a unified world, but we're not there yet. And we think that there's a lot of wonderful forces in the world that will bring that about. Many groups are working towards removing this. So first and foremost is that what is the content that they just saw? If they're seeing, I don't know, children suffering somewhere, it's okay. It's a natural human response to feel that emotions. We shouldn't be burying them. And then I would look into whether or not the source that they received that information was valid, or was it just to sell them something and it just got their system up. So I go over a little bit of the neurobiology of getting people excited about events. And then beyond that, if they can sort of shine some sort of a perspective and also balance their news of that information with other wonderful activities that go on in their communities. And in every community in the world, there is something good going on. People are working on education of children, on really helping each other in times of need. We can see that and focusing on that part of the news too. So in a very non-judgmental, explorative, giving time and not immediately jumping into giving quick advice to people, I think that's also important to invalidate their concerns.
In fact, in your article, it said that, of course, unity is a psychological necessity. Sometimes it's very challenging to foster unity in their own lives of patients when everything outside or the outside world is so divided, right?
Yes, that's correct. And part of it is that, we talk about, I know it's become very much invoked just to be in the present and be aware of the power our current moment and everything. But I also see and trying to convey again in a way that is universally accepted, not with one form of language or the other, that the evolution of humanity collectively is moving in the right directions, even though sometimes the immediate future appears dark. So, yes, we can't deny the fact that there's a lot of horrible atrocities, verbally, physically, wars going on. But collectively, there are things that are happening in the human world that ultimately that unity that I first mentioned is in the way on in our future.
Hmm.
And then, of course, our personal experiences, childhood experiences, they differ, they vary. And I think there's always going to be some problem areas that we deal with. But the thing is that we acknowledge that we're not alone and we're not judged. And that whole sense of, I know a lot of people emphasize, but I think that's a very important concept that shame that makes us feel like we're inherently bad as opposed to something happened to me and that's my experience and I have a different experience. Many immigrants, for example, I see in my practice that have that sense of like, am I inherently bad, that there are just certain things that have happened to me that other people won't be able to, I can't even explain it. And just like exploring that and opening that up itself is very healing.
We're talking to Fareed Sabet. He is a psychiatrist. Today's Kevin MD article is The Psychological Trauma of Polarization. Fareed, let's end with some take home messages they want to leave with the Kevin MD audience.
I just think that for all the physician and health practitioner audience, your role is a lot more important than you think in bringing about positive change, not only in individual lives, but also in your families and society. And always be aware of your own self-care because there's a big price that we pay as physicians in this field because we are privileged to have the front row seat into human struggle.
Fareed, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you kindly.